Ever wondered why you suddenly feel an urgent need to go to the toilet, especially when you're pregnant or a senior citizen? Well, you're not alone. This sudden, almost frantic urge to urinate is something many of us have experienced at one point or another, and it's not just a random occurrence. There's a whole science behind it, and it's linked to various physiological and medical factors. Now, when it comes to pregnancy, the urgency to go can be attributed to a few key factors. For one, as the uterus grows, it can exert pressure on the bladder, reducing its capacity to hold urine. Hormonal changes, particularly increased levels of progesterone, can also affect bladder function. Furthermore, pregnancy can heighten bladder sensitivity, causing it to contract more often, even when it's not full. And let's not forget about the weakening of the pelvic floor muscles during pregnancy and post-delivery, which can lead to urinary leakage and urgency. As for senior citizens, age-related changes can also play a significant role. With age, the bladder may become less elastic and muscle control may weaken. This can lead to issues such as urgency, frequency, and even incontinence. Medical conditions that become more common with age, like overactive bladder, urinary tract infections, and benign prostatic hyperplasia in men, can also contribute to this urgency. Neurological conditions and certain medications can also play a part. Interestingly, our body has its own set of physiological responses that can explain this urgency. The urge to urinate occurs when the bladder contracts due to a signal from the nervous system. This is a natural response triggered by the bladder reaching a certain level of filling. The bladder also contains stretch receptors that detect when it's filling with urine. When the bladder reaches a certain volume, these receptors send signals to the brain, creating the sensation of needing to urinate. Stay tuned as we delve into these causes and shed some light on why your bladder might be sending you scrambling for the nearest restroom. Shifting gears from the bladder, let's discuss another type of urgency that's equally significant: the sudden need to have a bowel movement, also known as fecal urgency. This condition can be influenced by multiple factors. For starters, stress and anxiety can play a significant role. When we're stressed or anxious, our body releases stress hormones that can affect our digestive system. These hormones can cause the muscles in the colon to contract more frequently, leading to a sudden urge to have a bowel movement. Next, we have irritable bowel syndrome, or IBS, a chronic condition that can cause symptoms such as cramping, bloating, and changes in bowel habits, including diarrhea and constipation, leading to frequent and urgent bowel movements. Diarrhea, characterized by loose, watery stools, is another common cause. It can be triggered by various factors, such as food poisoning, viral infections, or certain medications, and can create a strong urge to have a bowel movement, even when there's only a small amount of stool in the rectum. Surprisingly, even constipation can lead to a feeling of urgency. When hard stool accumulates in the rectum, it can irritate the rectal lining, causing a feeling of fullness or blockage and creating an urge to defecate, even if there's no stool ready to be eliminated. Understanding the causes behind fecal urgency can help you manage this condition better. But the journey of understanding doesn't stop here. Stay tuned as we delve deeper into the world of bodily urgencies. Firstly, let's explore why pregnancy can make you feel like you're always on the toilet timer. During pregnancy, your growing uterus can put increased pressure on the bladder, reducing its capacity to hold urine. This can lead to more frequent trips to the bathroom and a constant sense of urgency. Hormonal changes are another factor. Increased levels of progesterone during pregnancy can relax smooth muscle tissue, including your bladder muscles, making it easier to feel the urge to urinate. Pregnancy can also heighten bladder sensitivity, causing it to contract more frequently, even when it contains small amounts of urine. This increased sensitivity can contribute to urgency and occasional leakage. And don't forget about pelvic floor weakness. Pregnancy and childbirth can weaken pelvic floor muscles, which support the bladder and other pelvic organs. This weakness can result in urinary incontinence and urgency. So pregnancy can indeed turn your bladder into a ticking time bomb, but it's not the only factor at play. Now, let's talk about age, another key contributor to the urgency to empty your bladder. As we grow older, our bodies naturally undergo changes. The bladder may become less elastic, and the muscles controlling its emptying may weaken. This can lead to increased frequency of urination and a sense of urgency. In addition, the bladder muscle can become overactive, causing a sudden urge to urinate. The capacity of the bladder may decrease, and the efficiency of the urinary sphincter may diminish with age. Both senior women and men can experience pelvic floor dysfunction, which includes weakening of pelvic floor muscles and reduced bladder control. Certain medical conditions that become more common with age, such as overactive bladder, urinary tract infections, and benign prostatic hyperplasia in men or pelvic organ prolapse in women, can also cause urgency and urinary symptoms. Moreover, neurological conditions like Parkinson's disease, stroke, or nerve damage can affect bladder control. Lastly, certain medications, particularly diuretics, can increase urine production and prompt urinary urgency. Aging can certainly put a strain on your bladder control, but there are also physiological responses that can cause the sudden need to go. Lastly, we'll look at how our body's natural responses can trigger an urgent toilet rush. Ever wondered why you suddenly feel the need to go? Let me explain. The urgency to urinate occurs when your bladder contracts. This contraction is a natural response triggered by your bladder reaching a certain level of filling. It's all down to your body's communication system, really. Inside your bladder are stretch receptors. Think of these as your bladder's alarm system. When your bladder starts filling with urine, these receptors get to work. Once your bladder reaches a certain volume, these stretch receptors send signals to your brain, creating that familiar sensation of needing to go. It's your body's way of saying, hey, it's time to find a restroom. So your body's natural responses can also send you rushing to the restroom, but remember, it's all part of being human. Let's quickly recap what we've learned about the urgency to go to the toilet. Pregnancy, with its hormonal changes and physical pressures, can intensify the need to urinate. Aging too brings changes to bladder function and control. Furthermore, our physiological responses play a crucial role in signaling when it's time to go. Remember, if you're experiencing frequent or severe urgency to go to the toilet, it's always best to consult with a healthcare professional. Stay informed, stay healthy, and thanks for watching. Let's talk about what to do if you're frequently feeling the urge to urinate. First, it's important to get a medical assessment. This could include a physical exam, urine tests, imaging studies, or specialized tests to assess bladder function. Remember, if you're experiencing symptoms like pain, burning, or even blood in your urine, don't delay in seeking medical help. Next, let's discuss treatment options. These depend largely on the underlying cause of your symptoms. They may range from lifestyle modifications, such as bladder training and pelvic floor exercises, to medications, behavioral therapies, and even surgical interventions in some cases. For those experiencing pelvic floor weakness or dysfunction, pelvic floor physical therapy could be beneficial. This therapy focuses on strengthening your pelvic floor muscles, which can greatly improve bladder control. You might also consider bladder retraining techniques. These involve gradually increasing the intervals between each trip to the bathroom, helping your bladder to hold urine for longer periods and reducing the urgency you feel. Lastly, managing your fluid intake can also be a huge help. This involves avoiding bladder irritants such as caffeine and alcohol, and establishing regular toileting schedules. These simple changes can help manage urgency and other urinary symptoms. Remember, always consult with a healthcare professional for personalized advice and treatment. Before we wrap up, we'd like to extend an invitation for you to join our community. If you found this video informative and helpful, please consider subscribing to the MedSign Health 360 channel. We strive to bring you more interesting, challenging, and high-quality videos covering a wide range of medical and health topics. Your support is invaluable to us. If you've enjoyed this content, don't forget to give us a thumbs up. This not only supports our channel, but also helps us reach more people who could benefit from this information. We'd also love to hear your thoughts and feedback. Do you have any experiences or tips you'd like to share? Or perhaps you have questions or suggestions for future topics? Feel free to drop a comment below. Remember, your support helps us in our mission to bring crucial, latest, and systemic medical and health knowledge to everyone, because we believe in better health for a better life. Thank you for watching and for being part of our community.